Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here is what I bring to you all from the world of medicine. Rare link between genetic connection for depression. A new study by the US Department of Veterans Affairs found that pharmacogenomic testing can help providers avoid prescribing antidepressant medications that may have undesirable outcomes. Pharmacogenomics is the study of how genes affect the body's response to drugs. The researchers also found that the patients who underwent genetic testing had more positive outcomes compared to patients in usual care. Over 24 weeks of treatment, the group with genetic testing had a drop in depression symptoms with a peak effect at 12 weeks. Each patient in the study had major depressive disorder. Symptoms of that health condition included insomnia, loss of appetite, feelings of sadness and depression, and thoughts of dying by suicide. The results appeared in July 2022 in the Journal of the American Medical Association. The patients enrolled in the study were initiating or switching treatment with an antidepressant drug. The study included nearly 2,000 patients from 22 VA medical centers who were randomized evenly, with half receiving pharmacogenomic testing and the other half getting usual care. Oslin and his colleagues aimed to learn if genetic testing helped patients receive fewer medications with predicted drug-gene interactions and if that produced better outcomes. A drug-gene interaction is an association between a medication and a genetic variant that may affect a patient's response to drug treatment. Having that information helps the provider select the appropriate dosage for a specific patient. Patients in the control group received genetic testing, but their providers didn't see the results. That meant that those providers made medication choices for their patients that weren't supported by pharmacogenomic tests. The study found a marked shift in prescribing away from medications with significant drug-gene interactions or moderate drug-gene interactions. Overall, 59% of the patients in the genetic testing group received the medication with no predicted drug-gene interaction, compared to 26% in the control group. The researchers defined that difference as statistically significant and clinically meaningful, the researchers concluded. How belief in spirituality helps to have a better health. Spirituality should be incorporated into care for both serious illness and overall health, according to a study led by researchers at Harvard. This study represents the most rigorous and comprehensive systematic analysis of the modern-day literature regarding health and spirituality to date, said the researchers. These findings indicate that attention to spirituality in serious illness and in health should be a vital part of future whole person-centered care, and the results should stimulate more national discussion and progress on how spirituality can be incorporated into this type of value-sensitive care. According to the International Consensus Conference on Spiritual Care in Healthcare, spirituality is the way individuals seek ultimate meaning, purpose, connection, value, or transcendence. This could include organized religion, but extends well beyond to include ways of finding ultimate meaning by connecting, for example, to family, community, or nature. A structured multidisciplinary group of experts called Delphi Panel then reviewed the strongest collective evidence and offered consensus implications for health and healthcare. They noted that for healthy people, spiritual community participation, as exemplified by religious service attendance, is associated with healthier lives, including greater longevity, less depression and suicide, and less substance use. For many patients, spirituality is important and influences key outcomes in illness, such as quality of life and medical care decisions. Consensus implications included incorporating considerations of spirituality as part of patient-centered healthcare and increasing awareness among clinicians and health professionals about the predictive benefits of spiritual community participation. The 27-member panel was composed of experts in spirituality and healthcare, public health, or medicine, and represented a diversity of spiritual or religious views, including spiritual not religious, atheist, Muslims, Catholics, various Christian denominations, and Hindus. Researchers concluded that overlooking spirituality leaves patients feeling disconnected from the healthcare system and the clinicians trying to care for them. Integrating spirituality into care can help each person have a better chance of reaching complete well-being and their highest attainable standard of health. about a rare genetic kidney condition and its management. Recent research published in JASN uncovers an overlooked mechanism that likely contributes to this condition. The findings provide a better understanding of ADPKD and may lead to new strategies to treat it. Research indicates that the polycystin 2 protein in cells, endoplasmic reticulum, is important for maintaining kidney health, and its lack can contribute to autosomal dominant polycystic kidney disease. Loss of PC1 and PC2 in cilia is believed central to the pathogenesis of cyst formation that's a hallmark of autosomal dominant polycystic kidney disease. PC1 and PC2 can be expressed in other locations, however, and it's unclear if these forms of the proteins are also important for preventing autosomal dominant polycystic kidney disease. To investigate, researchers examined the role of PC2 in the endoplasmic reticulum, or ER, a structure within cells that's involved in protein and lipid synthesis. The team found that PC2 in the ER is important for maintaining kidney health and that its loss can lead to cyst formation. Endoplasmic reticulum localized PC2 blocks cysts presumably by functioning as a potassium channel to facilitate the exchange of potassium and calcium. When the researchers bred mice to lack PC2, the animals developed cysts, but this could be reversed by breeding the PC2 lacking mice to express a different potassium channel called the TRK-B in the endoplasmic reticulum. Current dogma of ADPKD is that it is a disease in which defects primarily originate in the cilia. We demonstrate that defects in the ER perhaps play a more important role. Furthermore, the function of the PC2 in the endoplasmic reticulum is to regulate potassium movement to affect calcium balance indirectly. In addition to providing these insights, the research suggests that activating TRK-B may be a promising treatment strategy for autosomal dominant polycystic kidney disease, the researchers concluded. Why maternal mortality is much lower in the United Kingdom. New research from Scotland published in Anaesthesia, Journal of the Association of Anaesthetists, shows that the increased risk of severe maternal sickness or complications or morbidity is associated with a range of risk factors, including increasing maternal age and levels of obesity, and also previous cesarean sections. Even though maternal mortality is no longer reducing, although the UK rate is low by international standards, nor is it going up, and the authors believe a possible explanation for this is that UK maternity services are continually adapting to meet the needs of this increasingly complex pregnant population. In this study, the authors analyzed 17 diagnoses and 9 interventions as a composite measure of severe maternal morbidity for pregnancies recorded over 14 years in Scotland. Any women presenting with any of these conditions or needing any of these interventions was considered seriously ill. There were 762,918 pregnancies, of which 7,947 recorded 9,345 severe maternal morbidity events, with 2,802 episodes of puerperal, that is postnatal sepsis, being the most common, that is 30% incidences. Severe maternal morbidity incidence almost doubled from 9 in 1,000 pregnancies in 2012 to 17 in 1,000 pregnancies in 2018, due in part to puerperal sepsis recording. The risk of severe maternal morbidity was higher for older women, with those aged 40 years and over 44% more likely, and those 35 to 39 years 22% more likely than those aged 25 to 29 years to experience it. Women with severe obesity, that is BMI of 40 kg per square meter or higher, were 32% more likely to experience severe maternal morbidity than those women in the normal weight range, that is BMI 18.5 to 24.9, while women in the less severely obese range, that is BMI 30 to 40, were 13% more likely than women of normal weight to experience it. Women having a multiple pregnancy were 2.4 times more likely than women carrying a single baby to have severe maternal morbidity, and those with 3 or more pre-existing health problems were 4 times more likely to have it than women with no health problems. Women who had required a previous cesarean delivery were 52% more likely to have severe maternal morbidity than those who did not. The authors concluded that the increasing prevalence of these factors in UK mothers might stall historical reductions in maternal mortality and will increase the need for healthcare during pregnancy and childbirth. They explain that one quarter, that is 26% of pregnant women, had obesity of BMI greater than 30 at the time of antenatal booking in 2021, while over half of pregnant women in Scotland had overweight or obesity, that is BMI greater than 25 at the time of booking in 2021. The proportion of pregnant women with obesity had increased from 1 in 5 in 2011 to 1 in 4 in 2021. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.